Next we'll look at the radial nerve, C5 to T1. The radial nerve innervates all three heads of the triceps brachii, the medial, lateral, and long head, the brachioradialis, as well as all extensor muscles of the forearm, including the supinator. So all the muscles of the forearm are innervated by the radial nerve. What are those extensor muscles? Extensor carpi radialis longus and brevis, extensor carpi ulnaris, extensor digitorum and extensor digiti minimi, extensor pollicis longus and brevis, abductor pollicis longus, and extensor indicis. Those are the extensor muscles of the forearm, and also the supinator, which I forgot to mention in there. The cutaneous branches of the radial nerve include the posterior cutaneous nerve of arm, posterior cutaneous nerve of forearm. Let me show you those first. The posterior cutaneous nerve of arm is located, so this area here is the arm. So this is the anterior view, so you have to go to the posterior. This is the posterior view, this is the arm, so this here is the posterior cutaneous nerve of arm. It's right where your triceps are, at least right in the center. The tendon of the triceps would be here. The posterior cutaneous nerve of forearm is runs here, right along the back of your forearm. Remember, this is the medial and this is the lateral side. Here. It also gives off two other branches. One is called lower lateral cutaneous nerve of arm and the superficial branch of radial nerve. We saw in the axillary nerve gave off here, remember the axillary nerve gave off the upper lateral cutaneous nerve of arm, which innervated the lower half of deltoid. The radial nerve gives off a lower lateral cutaneous nerve of arm. So this part here, the arm, the lower lateral. So let me make that like this. The lower lateral cutaneous nerve of arm. And you can all see this from the posterior view. This would be here. The superficial branch of radial nerve innervates the skin on the back of the hand. Remember, this is the palmar, this is the dorsum. This was the ulnar nerve, and all of this is the superficial branch, cutaneous branch of the radial nerve. You have half of this finger, all of this finger, and all of this finger. Now there is one small detail you need to pay attention to. The upper halves of this finger, and this finger are actually innervated by the median nerve. Even though the median nerve doesn't have a posterior cutaneous branch, but the palmar branch, digital branches, also innervate the backs, the posterior sides of these fingers. So this half is all ulnar nerve, and then on this half, the lower half is the radial nerve, and the upper half, and all upper half here and all upper half here, is the median nerve. Lastly, we will look at two more nerves. One is called the supraclavicular nerve, and one is called the intercostobrachial nerve. These are not part of the brachial plexus. The supraclavicular nerve, C3, C4, comes from the cervical plexus of the neck. The intercostobrachial nerve, or T2, comes from the lateral cutaneous branch of the second intercostal nerve. All the intercostal nerves give off a posterior, lateral, and anterior cutaneous branches. Well, the lateral cutaneous branch of the second intercostal is called the intercostobrachial nerve. So what are these nerves innervate are here, shown here. The supraclavicular nerve from the cervical plexus innervates the top half of the shoulder, both anteriorly and posterior. Okay, that was the axillary branch. This is the supraclavicular. And the intercostobrachial nerve from the lateral cutaneous branch of the second intercostal innervates this area here, the most medial side of your arm. Okay, the most medial side here. Here and also on the back you can see it. Okay, intercostal brachial and supraclavicular. There's also this one little part here I forgot to mention. This part of the palm of the hand is innervated by the same superficial branch of radial nerve that innervates all of this dorsum of the hand. Okay, so it comes also on that side and innervates this little part of the palm, superficial branch of radial nerve. And regarding the spatial relation between the radial, median, and ulnar nerves, I have shown it here. So this here is your anterior view of the femur. Sorry, the humerus. So this is your arm. The humerus, the radius, and the ulna. This nerve here is the radial nerve. As you can see, it comes along the back posterior side of the humerus, turns, comes along the anterior, and then goes back along the posterior to innervate the extensor muscles of the forearm. The median and the ulnar nerve come within the same region, but then they split around, going around the medial epicondyle of the humerus. The median nerve coming along the anterior side and continuing downward along the anterior. Ulnar nerve goes along the posterior side, also continuing down alongside the lateral, along the medial border of the ulna.